All right, welcome to our session today. Thanks so much for being on the call. I have been talking all day on Zoom. It's an all day thing for me today. Let me talk some more. I hope everybody's doing great. We have so many things on this list. God love Carrie for putting together an agenda where I read it. I'm like, how many pages long is this that I have to talk about? So, hey, I got a couple of cool announcements. I'm really excited about a couple of things that are going on. We are going back to Red Mountain, and we've got a general public event. It's 4 days and 3 nights. It's just a nice melt immersion. Hallie Altman will be there. And so we might even get her to do some melt Pilates while we're in with the general public, but it's such a fun thing just to hang out for 3 days and just try to help people feel better. That one is July the 26th to the 29th. Carrie will put that link if you have people. Maybe you just want to go just, to the general public event. But we also have this, I'm super excited to say this, but we've got this instructor only event, 6 days, 5 nights there, July 31st to August 5th. And this is for all levels, so from hand and foot all the way out to level 5. The registration is selling out very fast. We're already up to we're up to 30 people, I think 32 people actually since this morning. And there's only 55 spots. So we're getting there. So if you are going to come, just the early bird saves you $500. If you pay in full, you save even more. And really the cost you guys have is for the room. That's it. It's so, if we're not taking in a lot of revenue for this. This is really for us as a company, as a team, as a community, to be able to go through whatever you guys want to go through, right? And to be able to do some classes, but also to work out techniques or frustrations and talk about certain things and try to adjust stuff together so that we can also refine your skills in both touch and verbal cueing, but also strategy, working with people. And I have so many cool questions today. It's like nuts, some of the questions you guys ask, which I would like to remind you, I'm not a doctor, and I so appreciate you guys want what I think, but I'll tell you what I think, so hopefully it'll help you. So anyway, the early bird, we have an early bird for this. It's still going on until April the 1st, so you still have a month, but by the time the early bird ends, it will be over. But listen, if you don't have a roommate and you want to save even more, we can set you up with another awesome instructor. And again, Hallie's going to be there. She is the co-creator of Melt Pilates, Melt for Pilates. So she's going to be doing some melted Pilates sessions during that instructor event. It's going to be a ball. It's going to be so great. And we are also going out to the UK, because we do have a big collective of you who are like, I just can't get to Red Mountain Resort. No worries, I'm coming out to you guys. We have a tentative date right now of October the 24th to the 26th. So it's a 3-day event with a 1-day general public event on the 27th. And my hope here is that a few things happen. We promote it, and people that are outside of your loops come to this event, but that you also bring some of your your students and get them to also come and hang out with us. And my hope here is that we get to introduce our group, our MELT instructors, to the general public. So hopefully some of you guys will stay for the general public day after the event, so that we can kind of connect everybody. We also have a level 2 training that is happening right now. It just started on the 13th. The late registration is up until February the 26th. This was the last of the 5 that I did, so I actually learned from how to do all the other ones, and I learned a lot to do level 2. There's a lot of great visual footage in that one. And I've just spent the last 3 months redoing, hopefully for the final time, the level 1 instructor training online. And it's awesome. Carrie, I don't even want to say how awesome is. Is it awesome?
It is awesome. I always say I don't know if I can learn anything else from Sue Hitzman, but every time she puts a video together, I even told her this last video she put together, we should send it out to all the instructors.
Yeah, so one of the, and this is interesting, Carrie, is that, so I'm always being asked, we don't have a video about this, we don't have a video about that. And I thought, okay, I'm going to go ahead, I'm going to create these videos. But as I'm creating the videos, I realize, I wrote a New York Times bestselling book. I don't know if anybody's heard about it, but it's called The Melt Method. Have you guys heard about this book? And there's this whole chapter called Chapter 14. And It's all about what I just did a video for you guys. But one of the questions was about what do you do with special circumstances and how do you create a melt map for your client? And I said to them, you know, there's really no one melt map for a person, right? Self-care is about exploring and doing different things and kind of challenging your body, right? So there isn't one melt map. And you guys know that if you go to Melt on Demand, there are collections. And the collections, like if you have knee pain, there's a succession of videos that I would try. I would try all different things to help stabilize your knee. So in the Melt Method book in chapter 14, I talked about these special circumstances and I put it into 3 categories, like surgeries, people who have like, you know, products inside of their body, they've got replacements, systemic and neurological disorders and mixed connective tissue disorders, lupus, fibromyalgia, cancer. And then the third one was pregnancy and postpartum. And so I did a video for you guys talking about the worries, the woes, the fears of working on people, and what do I do if they have cancer? And, you know, I hear you're not supposed to do this or that. And so I land some very solid foundations for you guys. And it's done. So Carrie, you can post it all over the place. Put it on their Facebook page, put it everywhere.
Awesome.
Make a poster board on it, bring it to Target, let everybody watch it there too. No, okay, so anyway, so there's that. So the level 1 March 12th retaker's price is $495. Now listen, if you just want to have the open access to the course, that's how much it is. But I'm offering you the Facebook page and all the bells and whistles and working through these. So if you want to take this again, it's $495. The regular price for hand and foot instructors is $1795. So I feel like it's a bargain. The videos, the footage I've put into it, I hope that it helps you guys visualize and conceptualize some of the power of level 1 that maybe I haven't said before. I hope that it helps you. Hand and foot, I have another one. Another training coming up, March 12th. Registration's open. Remember, if you guys use your reversion link, you earn $50 if somebody goes through your reversion link and signs up. If they purchase level 1 at checkout, your commission is $250. And we've actually had quite a few people who go and they use the affiliate link and then they sign up for the whole thing. It's $250 back to you. Here's the great thing. The reason I tell you guys about these trainings also, especially hand and foot, is to figure out a way to get some of you to go out there and see if you can get your local yoga Pilates community involved in MELT and recruit some of them to come and take these trainings. Because that to me is even more of a business for MELT instructors to recruit other community like-minded educators and get them trained. Now, every once in a while, somebody would say, why would I want to train other people in my local community? Then who will come to me? If you're excellent at teaching MELT, you're now the ambassador. People are going to be looking to you because you're the one that recruited them, right? So use that to your advantage. Create your tribe, create your community, be the educator, right? So these are opportunities for you guys to, per head, potentially make $250 for every person that comes into level 1 through you. So education, I think, is not to be selfish. Share it with your community. I got another one coming up, level 5. We have so many teacher trainings coming up. I'm not going to be able to keep it straight. This one is April the 2nd. Early access is open now. I love level 5. I think it all comes home at level 5. So great one to do. And by the way, if you come to the level 5 training in April, when we are out in Red Mountain, you will be able to hang out with the level 5 instructors, even though I don't think that the whole thing would be done, or you'll just be done with that. Just a reminder, the UK warehouse, it's closing March 1st. So you guys have free shipping with orders over $125 until March 1st. MELT tune-ups. I love that Carrie is doing this. She's doing the tune-up your hand treatment. This is February the 23rd at 11 a.m. Watching Carrie in her mastery during the hand and foot instructor trainings and watching her lead a breakout is awesome. You will quickly refine your practice of hand and foot. She's got this down like crazy. Next business call is with Carrie, March 13th. You're not sure how to run your business. You want a little bit more advice. You want to maybe use the resources more efficiently in the back of the website. Go and hang out with Carrie. March 12th, 2 p.m. Eastern Standard Time. Carrie's going to put that in the chat for you. Finally, I want you people on MELT on Demand. What are you doing? How on earth can I have thousands of instructors hundreds of you guys hanging out with us on Facebook, dozens of you guys coming to live calls, and hundreds of you watching these follow-up calls. And I don't have you guys doing Melt on Demand classes. You guys should be just finding a space like I do in my living room, getting yourself into a good sound, even if you don't have a mic. Actually, you can go ahead and send us your audition levels. Don't let the mic be the reason you're not doing it, because I might be able to manipulate that in post-editing and make it sound great. Little echoes I can work with, okay? So come on Melt on Demand. Actually, some of you guys have been on Melt on Demand, and what I love, once again, I see what we're paying out every month to instructors because their videos are popular, and it's awesome. There's thousands of hours being watched from instructors. I think this is so amazing. It's such a fundamental basis of the whole brand. Okay, another thing, Gil's Nerve Tour. Can we talk about Gil's Nerve Tour for a second? You all need to go. You all need to go. Don't wait. Find out where he is. Drive a few hours. Just sit with him for 5 hours and watch your brain explode. Okay, what he's done and the whole story of the process is so incredible. It's palpable. You guys will understand your nervous system better and have a richer understanding of this concept that, remember, it's all one thing. The sympathetic nervous system, parasympathetic nervous system, enteric nervous system, it's all part of the autonomic nervous system. It's one thing, right? We cut it up to explain it, but they're working together. There's two sides to the coin, and Gil's ability to send you down this nerve tour is just, I mean, he's a freaking enigma. I did a 22-minute chat. He came over and hung out with me after the event, and I was like, we're doing an anatomical gangster conversation. So we did, and you should listen to it. He's amazing. Of course, you already know this, but watch that nerve tour, okay? What else? Testimonials. Okay, here's another thing. I get to hear every time we start a new level training, people tell us how they found MELT and all these beautiful stories of kind of having a problem and finding this thing and then realizing there's like all this stuff to learn. I would love to have more testimonials from you guys. And so if any of you guys want to stay on after the call, I'll stay on for like 10 minutes. If you guys want to like give me your sound bite of like, you know, my back was killing me, or I've been doing Pilates forever. And, you know, I kind of learned a little bit about fascia and maybe I want to learn more, whatever. I don't know what your story is, but I'd love to hear it. I always love these stories. Okay, questions. Amy Brown, you sent me a very, very long message. I read the whole thing. Amy has had spinal surgery. She's got a cage. She kind of waited a little bit too long before she had actually had that first surgery in the 90s. But the thing is, all of these things, the leg hypertrophy, the leg twitching, the cramping, I'm telling you, this is all from the spinal column. It's not in your caps, right? It just isn't. Wow. It's a poor message from your brain to your body. And I have to tell you, in my very many years of working with people who have had a very similar story as yours, my high recommendation, and this is just Sue's recommendation to you intuitively, I would go find an acupuncturist who does prolotherapy. Acupuncturist who does prolotherapy. You could find other people who do prolotherapy, and it might be fine enough, and I don't know if it would matter, but if it were my body, I would be having somebody inject me with prolotherapy and vitamin B all the way down my spine on both sides, and seeing, and I don't know if you guys know what prolotherapy is. It's like a saline injection that also has sugar in it. And so it causes a inflammation effect, which can then ignite neural pathways and heal tissues. And the problem with what you're talking about, Amy, with your whole story is, you know, the myelin sheaths around the nerves, when you have a lot of compression, it's kind of, you know, you're gnawing away at it. And even in the surgical procedures, it doesn't really necessarily fully repair that tissue. So core challenge is so important, doing things that are even outside of MELT, like the corrective rest position, putting your legs up against a wall, putting a towel under your back and letting your pelvis go into a tilt, and just breathing and allowing your mid-ribs to relax. 3D breath breakdown, 3D breath. These are all so important to stabilizing your spine in a better way and trying to minimize some of the compression that's going on in those damaged nerve roots. Do you hear what I'm saying?
Yeah, I do.
Yeah, it's tough. Yeah, it's a lot of work, but prolotherapy would be my first inclination to say, I'd go take a look at that. Second to that would be like maybe prolotherapy, but stem cells. All of these things, if I had, and Amy, did you post this on the Facebook page?
I did.
Okay, so everybody can go and find Amy Brown's post. And Carrie, will you post my post back to you when you told me about Amy and I emailed you back a reply?
Yes, I will.
Thank you. And I'm just going to have her post it because like I wrote something there and then I was like, oh, I'll talk about it on the call. Okay. Yeah. So, you know, when you have compression, damage to the nerve roots, that myelin sheath, the tissue around the nerve is what the big problem is. It's still abrading, right? So we got to stabilize. You really want to find that core reflex, kind of using that exhale to pump the tissue. Core challenge, advanced core challenge, but really thinking of the core reflex before you move your legs, pumping the tissue through psoas, really attuning yourself to the engagement and release of the thoracolumbar fascia. It's so important for these kind of issues. Yeah. Okay. I hope that helps you.
Thank you. Yeah, prolotherapy. Hadn't thought of that. I am doing acupuncture. I'll find out if he does it.
I love that. Thank you. Yeah, and then just report back to me.
Thank you.
Okay. All right, let's see. So I have another question here. Oh, Shayna Berry says, on the pre-class chat for the live class on last Thursday, I was talking about tinnitus. Somebody asked me about, some people call it tinnitus, it depends upon where you live, but tinnitus, whatever. It's a ringing in the ear. That I had gone on to say something about having clients who had bladder issues or infections that were related to tinnitus, and like, I just want to know more about that. Okay, so first of all, it's not so much about the bladder. There's, I think it's called urinary cotyle or something like that. It's people who smoke, a lot of times that can cause issues in the bladder that also you can check it in your urine, and that has a high correlation to what's going on in the brain. Tinnitus is really more of it's your nervous system. It's not your ears. It's something that's happening in the nerves. A lot of it has to do with blood pressure, cholesterol, high cholesterol, and it kind of damages some of the neural networks. There's kind of like a weird wiring of the neural networks, and that's why you're hearing it. That's why like I could really wrap my fingers into my ears so that like I can only just hear my own voice, and then I can move my fingers and I kind of hear whoa, 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 whoa. So I've lost any hissing or tingling or hearing that I might hear, and I press it in and I hold, and then I let it go. And if I don't hear the tinnitus, well, you know it's a brain thing, because I just tricked your whole brain's brain sense messaging. And if it dissipates for even just a few minutes, you know it's a brain thing. It's not an ear thing. Yes, the inner ear, cochlea, and the little hairs and they can kind of break down, but it's more in the brain. So what are some of the common causes of it? People, after you get a virus, people who had post-COVID, tinnitus is definitely related to it, because it's damaging neural networks. COVID damaged neural networks for people. So that's why I said. And then, you know, people who get consistent bladder infections, yeast infections, UTIs, a lot of times they also have tinnitus, and people who suffer with depression, bipolar disorder, also tend to have brain chemistry mishaps, and it causes neural networks to break down. So that was what I was talking about. Sonia, could I speak to shingles? Sure, I can speak to shingles. She says she's got a 50-year-old woman who has reoccurring episodes of shingles for 5 years, that she's had the shot and the boosters. You know, she's trying to push through it. She gets flare-ups, and you know, like if you're having lots of flare-ups, you're saying, I'm assuming that that's what you're saying. Are they consistent? Do they happen a lot, or are they just like just over the years? Is she here, Sonia? Are you here? Okay.
Yeah, they happen pretty consistently, maybe every 3 or 4 months.
Yeah, so people who are like that, first of all, you know, we all know that this is like a post thing of chicken pox, but people who have, after the age of 50, your immune system becomes less effective with aging. We know that that's true, right? Our body starts to break down. So if you have somebody who either doesn't manage stress, they tend to be kind of a type A personality, they tend to be a little bit more up on, things are kind of stressing them out a lot, or people who have had cancer, lymphoma, stress, any underlying health conditions, they're taking any type of medical suppressors of the immune system. It could be chemotherapy, could be corticosteroids, could be biologics. People who even take hormone replacement therapy, or anything like that. Those tend to be the people that get the reoccurring shingles that I've had my experience with. So there's usually some sort of a underlying health condition that's not being talked about. It's probably one of the most common things.
Okay.
Yeah.
Yeah. She's a type A. So,
Tell her to chill out.
yeah, she's trying.
Yeah. I mean, I think the one thing I always try to explain to my clients who are the ones that, like, when they come in, they kind of look like this, like their eyebrows are up and their shoulders are a little up and like they kind of look a little tight. And, they're sort of like with their hands sort of like this as they're talking to you. And you just kind of want to go, just kind of, you're like, oh, right. Is to help them to learn when you feel uptight or you're uncomfortable with something, try to be an observer observing your own behavior. So just try to take yourself a step out of the experience and be an observer in a process of observation with something that's being observed. Yeah. And sometimes if you can do that where, like somebody comes in and it's freaking annoying, like they're so dirty and like, the toilet's always a mess. And instead of, going in there and being like, can't you clean up the toilet and, kind of going in with this, you sort of pause and you go, wow, I'm really having a feeling about that. Well, why is that? Well, I feel like, they're not seeing me and they're not respecting my toilet and I'd like for it to be more clean, right? So if you then say, could I ask, would you mind cleaning the toilet so that I can live in peace and feel better about my house? Oh, sorry, I didn't know. And so I think sometimes we go into problems thinking that we're going to have a attack, right? We got to go in for the fight. But if we can, again, become an observer, having a process of observation about something that's being observed, sometimes your own stress levels can chill out. And so if I have somebody who's got type A, sometimes teaching them how to chill out and not just say, hey, relax. Because you know what that does? Stresses them out.
Right.
Gets more annoying, right?
Yeah, we've worked together for a year and that's what she's learning. So she's
Yeah.
right back.
Yeah. It's practice. Cool. Practice. Yeah.
Right.
All right, let's see. Nancy Preston. My client has a condition called idiopathic subglottis stenosis. Guys, so this is an issue in the throat, like it just gets, there's a tightening to it, a kind of a disorder. She says she's actually had scar tissue removed. Isn't that just depressing? Because when you, what do you think happens when you remove stuff from a scar or from your throat? What's going to happen? What happens? Somebody unmute yourselves.
Get more scar tissue.
You get more scar tissue. You actually get more adhesions. We actually cut into the very thing we're trying to create sliding and gliding with. What kind of craziness is this? But she goes on, continue on with this. She says she has 2 surgeries to remove scar tissue that impedes on her quality of breath. But it's not just breath, it's also swallowing, okay? She does sequences. I love the hands, face, neck release, upper body compression, length sequence, inner thigh gliding and shearing, rebalance sequence. Love all these things. Okay, if this is my client, a couple of the moves that are really beneficial for people who have the tissue tension here, and again, like this is a bit of a disorder, is doing things like the upper body compression sequence and adding the sternal decompress. Such an important one, right? Because it's going to activate all of the stabilization aspects in the spine, and it'll actually hydrate the throat. So it's a great one to do. Another one to that is neck turn reach and neck side bend. Such a great one. And to really, you remember, guys, you could do neck side bending seated upright. So you sit them up nice and tall, and you get them to do things where they bring their cheekbone away from their collarbone, their ear away from their shoulder, maybe taking their hand into their, I've got my mic there, into their tissue so that you're kind of drawing tension away from what they're doing here. And then letting it go. Those are all great ones to add to those types of issues. Also, rib side bend and rib length. All of those are really wonderful ones to do to aid in hydrating the tissue around the throat. And the other thing is, for throat issues in general, does she massage her own tissue? You know, like having her side lie and sort of rolling her fingers into the tissue like this. You can sort of hear how my voice kind of gets a little weird. I come over here. Right? So you see what I'm doing, right? So you just tip your head into it and just have her just daily, just give it a little pull. I think that's good for everyone. Okay, so I hope that that helps with that one. What else do I have? I love these great questions. Nancy Preston McNeil, she says she has a client who has a condition called ocular surface disease and blepharitis. She's been teaching her the MELT hand as well as face and neck release, neck decompress, rebalance sequence. She just has some trauma issues that she's dealing with, and I wonder if there was something she doesn't want to see. I may be overthinking this. Is there anything else we should focus on? Doesn't want to see. You know, isn't that such a cool idea? Doesn't want to see with what she has. Maybe. And so maybe speak to that. You know, I would go in with, instead of something that she doesn't want to see, is there something that she's wanting to experience? Maybe there's something else there, but I think your techniques are lovely. I think that these are all nice. I would definitely do the full face treatment. I love that idea, but I don't know. I don't think that, you know, if she has trauma, sometimes it's how you speak to your clients about their trauma, you know, asking them, like when you're working on her, with her, you know, as she's breathing into a space, ask her, say, you know, use your body sense and kind of like an investigator, go into your body and come, you know, send your mind right over to this region of your face or of your neck or whatever you're doing. And just, is there anything that this region of your body needs that we're not addressing? Just ask. And then see if anything comes up to her consciousness. I think that if we go into inquiry in the body, my body always tells me, and my body is always right. Okay, so I trust my inner voice more and more as I've gotten older. So maybe that's something to share with her. Susan Flanagan Holmes, she says, you have a client that feels tingly in her feet after doing her hands. She doesn't notice the tingling the day we start with feet, just the days we start with face and hands. I think that this is because we're waking up fluid flow, hence activating nerve movement. That's right. So Susan, you know, when you stimulate your feet first, the feet have a lot of neural receptors. And so your brain is already picking up where your periphery is. So she might get the tingling less, but the tingling oftentimes is just neural activation, kind of a little buzzy feeling. As long as it's not, you know, nervy where she's saying, I feel a tingly like I'm numb. I don't like numbness in tissue, but if you're kind of feeling that buzzy tingly sensation, but you feel it less after you've done your feet, it really is just because if you work with your footing, your nervous system is going to pick up your whole body. You know, your hands, yes, they are related to the neural core sort of in a fascial level because it's all connected, but really the central aspect of your foot is the neural core, right? The neural core is a pipeline through the skull. It's not really direct to the hands in the function and neurological reflexes and mechanisms. It's a different pathway. So hopefully that helps you with that idea. Wendy, she says, I'm seeing a new client in his early 60s tomorrow. He's taken part in extreme sports his entire life. After a quick chat on the phone, he tells me he's had a spinal fusion in his 20s, a lot of back pain now. Any advice on this would be greatly appreciated. You know, again, Above and below the fusion, compensation is likely present. Any moves that she should avoid? Or do I treat the person? Yes. And let him guide me on what feels right? Yes. But she's talking about, she's worked with other people with pain. The thing is, I always say, anybody who has pain, all they've done is given you information. Hey, I've had a cage in my back, and my back actually, as I've gotten older, gets consistently worse. The problem when you have a cage is the muscles around it atrophy. And so as we get more neural inhibition, it really is like the brain used to have a friend that it used to call, and now it's like, I can't remember that phone number. I'm gonna call this one, and it might be nearby motor neurons that activate. And in that, we get a lot of mishap. So when you have somebody who's had any type of back pain, I always just go with the low back pain protocol 100% of the time. I teach them a foot treatment. I do rebalance sequence, lower body and upper body compression sequence. I can do the neck release and then the low back, right? But I go indirect. So depending upon his ability, when you do the rebalance sequence to tuck and tilt, right, might not go so well. So remember, the movement isn't so much, it's not a, tuck and tilt is not a movement from the lumbar spine. The activation is from the pelvis. The lumbar spine just follows, right? So however it's going to follow, the movement of the pelvis is not so much about the lumbar spine, it's about your ability to control pevifemoral rhythm, the rhythm between your femurs, your thigh bone, and your pelvis, what rolls over the hip joint. That's more where our tuck and tilt is coming from, is pevifemoral rhythm, okay? So he should still be able to move his pelvis into a tuck and into a tilt. The discs that are fused, those are just going to all come as a unit, but the movement is subtle. So in doing it, you are rewiring neural pathways back to the pelvis, which are probably pretty inhibited at this point. I would be doing things like the 3D breath breakdown and the 3D breath. So again, foot treatment, rebalance, those would be the first things I would teach somebody with low back pain, really getting them to activate the core reflex, really getting them to differentiate their pelvis. And then I may go again to the lower body, do some compression through the lower body, and then I'd let my client tell me, how are they feeling? Is their back feeling better? If it is, I do upper body rehydrate. Because if I have low back pain, the upper body is always a stickler for fixation. So I'm gonna try to get some of the movement of his upper thoracic spine to operate again. And then I would maybe do the lower body length and low back release sequence. So it's a progression of trying to decompress unnecessary tension and reactivate this deep stabilization aspects of the neural core. That should be like the first objective with people like this. So don't treat the disorder or the lumbar fusion, treat the dude and help him to get grounded and reconnect him to his neural core. That's where I would start. And actually, Wendy, I do want to say, I think you already knew all of that. So you're welcome for me reinforcing your already stellar knowledge. Okay. Laura Hilliard, she says, I'd like to hear some thoughts on hip and knee replacements. Her clients mentioned she had a hip replacement in her early 20s. Her balance is off since. She's in her 60s. Her first class experience, mini hand and foot and gentle rocking on the roller. She mentioned this is the first time she felt almost balanced. I love that. A couple of things. Her balance has been off since she had the hip replacement in her early 20s. Why'd she have a hip replacement unless she had some instability in her pelvis? I'm just saying. So sometimes when we have a joint replacement, and this is really important that you guys hear me on this one, because I actually just had a client a couple of weeks ago who came and she said she's so mad about having to get this hip replacement, and like this doctor didn't do a great job, and she knew it was going to be a debacle because she had shattered her hip when she was younger. And I said, you're putting a lot of angry energy into this region. Do you think it will heal faster if we give it love or anger? She was like, that is a really profound statement. I said, which is it? She said, love. And I said, if we go in saying, this hip replacement is now of me. It is part of me. So I'm not going to be angry and push it away. I'm going to help it to become more a part of me so that we can connect in a way that I don't feel so off balance, first of all. Okay, so if I have somebody with a hip replacement, what's their relationship with their hip replacement or their knee replacement? Are they angry about it? Is it frustrating? Has it caused a lot of pain, right? Know their relationship with the replacement first. First class experience, mini hand, foot, gentle rocking on the roller. And she mentioned it was the first time she almost felt balanced. How awesome, right? Those are some of the incredible things to teach people, is how just doing hands, feet, and rebalance can help your brain feel more centered in the body, feel more attuned to the neurocore. I think what an amazing thing that is. I feel more myself, I feel more balanced, more in my system. Awesome. That's the best place to start. So people who have hip and knee replacements, I mean, I've never worked on somebody who has hip and knee replacements where I'm like, no, let's skip the foot treatment. No, it's the first thing that they learn, and they go home and they do it. And I'm one of the ones that emails them twice in the week, checking in. Have you been melting your feet? I didn't get to it today. You know what? That's like saying you didn't get to go to the bathroom today. It's that important. Melt your feet. I'm melting them right now, Sue. So you see, you just get them to do it. It's like working with kids sometimes. Patty, she says she has a 79-year-old client. Seen her for 8 years. She teaches Pilates, MELT. She's had 2 neck fusions. She's fused from C3 to C7. Most recent fusion was about 3 to 4 years ago. She has arthritis in her upper cervical juncture. Of course she does, because she has fusions. She works out with a personal trainer. Currently, she has neck pain the majority of the time. She uses a pillow while lying down. She can't lie fully flat. We've done MELT on the wall. She has a hard time negotiating on the travel roller on the wall. Any ideas would be appreciated. Okay, well, we already know basic skull shear will be a great thing to do directly. But when you have, and I can't wait for some of you guys to see the new level 1 instructor training, because Carrie got to see it. I did a whole thing about the OA joint and the cervical spine and gave you visuals, and it will help all of you guys understand the importance of this. So, you know, the way your nerves branch out, you know, from the base of the skull and all of the periphery here, when we have fusions, this little gliding, the skull kind of gliding on the atlanto-occipital region, it doesn't roll, right? And so the atlas and the axis, the bit of rotation, also gets fixated. And that has everything to do with the writing reflexes, eyes, ears, and teeth in line with the horizon. And so now you become fixated. And yes, of course, you'd have neck pain. But what I would be thinking of doing is trying to get her into thoracic extension. So I would be doing like rib side bending, rib extension, breathing in and really finding her core and trying to get length. I'd be doing upper body compression with a sternal decompress. Sternal decompress, really great for these kind of things. Neck turn reach, really important. Over base of skull shear. These are more indirect to the bones themselves, and, you know, like the pressure, and more to the tension against the tissue. Those would be the things I would kind of consider doing with somebody like this. And then getting them into doing any neurostrength techniques. Patty, in one of the MELT classes there's actually a video of it. I can't remember what it was called. Maybe Carrie, you might remember. It wasn't too long ago, maybe a month ago, but I'll show you this. If you take a resistance band with people like this, and you can have them just sitting in a chair. I'm going to do it in a quadruped pose because I don't have anything to tie it to, but the band would be here, and you would tie it onto something here so that there's a pretty good amount of tension. It's going to make their head want to go like this, and you're going to be retracting back. And just so you can kind of see what I'm doing here, right? I come from forward to back. And I'm learning to regain the strength in those suboccipitals, and then I can tie it into, you know, my whole spine. And so I just extend, and I take the hand off, and then I go back through that motion. Those are all great ones to do with cervical issues, very direct neurostrength techniques. The other things, again, I would do is anything that's going to strengthen rhomboids. So that could be, again, outside of MELT, even with Pilates, doing something where you have a cable and you're squeezing and you're getting your shoulders to go back, right? So if my shoulder blades squeeze backwards, that's rhomboids. I hold and then I let it go. So I want to make sure that she actually has good connection to rhomboids. I might want to do pulls this way. I might want to do a squeezing this way. So again, I'm going to rhomboids, but then after I've got rhomboids active, then I might want to go to rear delt, right? Side lying backhand. I might want to go side lying arm fan, right? So all sorts of options for you, okay? So hopefully that gives you guys some ideas. You know, I think sometimes we think MELT is going to cure things, and it's not a religion and it's not a cure for anything. And remember, hydrating fascia is a door that you're opening to then go into neurostrength. By no means should any of you guys not hear me say that if I were super brilliant and could have figured out a way to put the 6 R's of the whole method into my first book, it would have been better for everybody. But I just couldn't. I mean, nobody had really written about, for the layman person, fascia. So I was like landing that idea. But neurological reintegration and repatterning is where you want to go once you're hydrated. So that's what I'd be doing. I hope that helps. Carol, is there a chance, so Carol Gray is asking me, is there a chance I can science geek a little, not her forte, about presenting to some bigwigs at a pain event? One thing they're all excited about is the mitochondria and pain, and that you'd love to better understand that and how it could relate back to MELT. Okay, so first of all, my high encouragement is to not speak like a wise person on a topic that you don't really know very well. I will give you this. Carrie, I put a post in one of the Frontiers of Science, one of their pain discussions on the mitochondria. So fibroblasts have mitochondria in them. And so they are definitely a engine toward creating pain. And there's all sorts of new mitochondria research that's happening right now. So to me, what I would remind people of, if I wanted to tie it back to MELT, is first of all, read that article. It might help you a little bit to give you a little understanding of where that research is going. And there's piles more. I just like pulled up the first one that I had read before. But the thing to remember is that you are stimulating the cells of fascia, and in that you are stimulating your nervous system, and you're creating a new conversation between cells, the extracellular matrix between the intracellular spaces and the intracellular spaces and the intracellular region of the cell, communication between cells, in cells, outside of cells. So it would behoove us to not learn more about fascia and the fluid flow of fascia and how fascia provides a structural stabilizing system for other tissues to live in. So in this regard, I think I might mention things like, you know, fascia connects your muscles to your bones, to your organs, to your nerves and blood vessels, which is why they call it connective tissue. Fascia is connective tissue because it connects everything. But it possesses 250 million nerve endings. That's more than what's in your skin. So superficial fascia, there's so much going on in superficial fascia where our fat is. There's chemicals, there's hormones, there's neural transmission, and the fluid perfusion of fascia and it being a highway for neural communication, it's imperative that we keep this tissue supple and moving so that the sensory nerves are kind of like seaweed in nice, fluid, juicy systems rather than being all dried out and kicked together. I would kind of maybe use a metaphor. But again, you know, if you're talking to really smart people, my biggest advice is stop trying to sound as smart as them, because they only know what they know and you only know what you know. So if you stay in your lane and you speak on a topic that you know, and you even speak from an experiential place, you know, I practice this technique and theory of the method, you know, like that we're not causing facts, we're not getting into science. The theory of the method is that a body in motion stays in motion. And so one of the primary systems that helps us do that is fascia, and the other one is your nervous system. And You can plank, pike, twist, and 100 yourself and strengthen your muscles all you want. But if we actually drive our focus to stability and what stabilizes us, and we consciously help support the stability systems of our body, I bet we'll be more stable. And that's kind of the principle of the method. So on mitochondria health, cells need a stable environment to function efficiently, just as much as your muscles and bones do. Cells on a microscopic level need a stable environment. Fascia provides that stable environment. And so juice up your fascial tissue so that all of it works better. I don't need to be scientific, right? Just speak from a self place. This is in my experience. This is what I know. Okay. Lori, she has a Hallux Limitus of the right big toe. She's managed well with the combination of foot treatments, lower body compression, length, pelvic floor, neuro strength, toe spacers, metatarsal pads, foot-friendly shoes. I think the inner leg line, pelvic floor are related to this. Is that correct? Can I say more if it's not? You know, just the big toe in general has a lot to do with gait. You know, it's a huge gait pattern player. So hip stabilization, you know, I think for me, anything with the ball of the big toe, I would be doing things like inner thigh lift, side leg lift, clams, mini bridge, knee knockers. I would go to stabilizing my pelvis more. Sometimes I find in my yoga class, I watch other people in front of me, and they're doing things where their femur is radically buckling inward and they're pronating tremendously. And that to me looks like a pain point for a big toe and a knee. So if you do any standing work, every once in a while, what is a fun thing to do, and I've done this in the MELT classes. Every once in a while, I get a little crafty with my classes, but sometimes what can be fun is if you take your small soft ball and you put it around the medial arch, and you can do it at 3A or 3B, and you do things like squatting and then trying to lift your toes and then bringing them down and coming back up. And what it does is it sort of drives a bit of focus to the flexor hallucis longus and the big toe. And then, you know, you could then try to roll over your toe. And if you're like, that's what kills me, you know, doing things with the, I'll give you guys a couple of little tips, a couple of quick techniques. I did this one actually recently in the MELT class, where you take the roller and you put your big toe. Oh, you guys can't see it. Hang on. Let me bring it way down here if I do it this way. So you put your big toe on your roller, and all I'm doing is just bending my knee. And then I'm coming back up. And what, again, I don't want to do is pronate. I'm not falling. My whole foot still has good stability to it, right? Still on the ground. And then I bend my knee. And then I straighten it back out. Such a great one to do. You know, you don't really realize how much just a knee bend has an effect to the forefoot. But when we go through gait and you're about to push off the ball of the big toe when your knee is bent and this leg is out and ahead of you, right? You're kind of stopping the big toe from going down. And so some of you, when you do it, you're going to get a lot of awareness of the connecting lines up behind the ankle. And that can really help to bring blood flow back to that joint, might help you move the joint a little bit more, you know, and then the foot treatment. I hope that helps. Also, Lori has a rotator cuff injury on the left side. Right hip and low back instability, right? So she's got that spiral, and this is probably also contributing to the same thing. She had a decade of low back spasms that originated. The MELT practice has eliminated it, but she's been practicing shoulder stability lessons on MOD, and I talk about the Serape Effect. Yeah, so Lori, the Serape Effect actually in levels 4 and 5, that's where we kind of get into the weeds of that. And there's all sorts of movements where we can create the connection between the deep longitudinal line, the spirals that wrap around the torso, the spirals that wrap over the hip and down to the foot. So lots of techniques, all the level 4 and level 5 techniques, they're all very much inherently linked to this. Level 5 is all up in a huff over the Serape Effect. I go into super detail about it. But doing moves like prone Superman, assisted Superman. I don't know, all of those would be great ones to offer some opportunities. But just your right hip and your left shoulder, there's a Serape, a wrapper that continuums, yeah? And there's certain muscles that are a true Serape over the torso. It's just, again, how muscles stabilize our cervical spine and our lumbar spine when we move. Angeline Shaka, she says, I was hoping that I could talk or make a video about the critical thinking behind choosing when to rinse. I recently did a shoulder saver map on MOD, and after doing rib length assess and upper body compression, I specifically mentioned choosing not to rinse yet and went into some neurostrength stuff and then rinsed after. Why might I rinse right away versus right after? Really, Angeline, if I had time, I would do it in both areas. I could do it in both. But the idea here is that, remember, when you create gliding and shearing, those are local compression techniques. So you will create a local fluid exchange. And think of it like, you know, massaging one area of your body. Like if I kind of rubbed you here, but I didn't rub you down here, you might feel heat up here and not down here. Right? So if you go local and you glide and shear and you pool the fluids, that could actually help to create better stabilization because we've stabilized, we've brought fluid flow to the local region that we're going to activate. And then with our own muscle movers, and we do neurostrength in that instance, you are pumping and releasing the fluid flow with your own muscle contraction, right? It's kind of an indirect way to get fluids into tissues is contract and release muscles, right? That's why movement is so important. And then if you rinse afterwards, you might just get a bigger fill effect. But most of the time when I do things like that, it's because I'm doing a class and I want to get a lot done. And so I just kind of put an interruption somewhere in the middle of it, put neurostrength in, and then I keep going with rinsing. But try it both ways, see what works for you. Again, if I had more time, I'd rinse, I'd do a whole upper body, and then I go into the techniques. But it's kind of like the foot treatment. Sometimes I tell you guys to do position point pressing, gliding, and shearing, and then do the position point pressing with the small ball, and then go through gliding, shearing, rinsing, and friction with the large firm ball, right? So I wait for the rinsing until I've done it with the firm ball. I didn't do it. So I kind of pooled more fluid. I've created just local compression techniques, and then I'm rinsing at the absolute end. It's just a different process. You know, and again, whatever works in those directions for you. Susan Holmes, that's so cute. She has a mom who wants to bring her 6 and 9-year-olds to class or schedule a private. Would the full roller be too big? Should we do a half roller? Thinking maybe a pool noodle or beach towel if their frames are small. Okay, do not bring a 6 and 9-year-old to your class. Okay, no. Schedule a private, okay. 6 and 9-year-olds, it really depends. You know, I have a friend who has a 6-year-old and I'm pretty sure she's a 27-year-old reincarnated person in a 6-year-old's body. Her words that she uses, well, actually, Sue, I would perceive this to be more, and I'm like, did she just say perceive? What is she saying? Like, where'd she get these words, right? I mean, I don't even know how she knows these words. So it's really about the kid. The thing I know about kids is that they are actually very intuitive, but you've got to make it a little fun. So you're a little quicker in your delivery. You're teaching them less and having them experience more. So you might do something like, okay, close your eyes. Try to keep your eyes closed and tell me if, let your feet stomp on the ground for a second so you feel both feet and then stop moving. Do you feel like one foot feels more on the ground than the other? Are you noticing one foot feels different than the other? I don't know, I can't tell. Some of them will be like, yeah, I have more weight on my left foot. They'll tell you. Okay, remember that, open your eyes. Let's do this technique. And now what do you feel, right? So you just kind of just go and do things. So don't bring them into your class. Is the big roller too big? It depends upon their size. Most of the time with my younger kids, if I'm lying the length of the roller, I do it on a half roller or I roll a towel. You could do it on a pool noodle, depending again about the petiteness of them. I don't think I'd have a problem with that. But the one thing I do want to remind you guys of is kids are mushy. Kids ideally are more hydrated than we are. Their cell proliferation is like popcorn on a hot stove, whereas ours is like old, burnt, crusty stuff that is like sitting at the bottom. I hate to say that, but we are producing many less cells than we are losing, ladies and gentlemen. It's terrible to say it, but once you reach 24, your cell proliferation is going from this to it's starting to go like this. And then by 40, it's this, and 50 and 60 and so on. Okay. So I would make it fun. I would roll a little bit. I would have them do like maybe a core challenge technique and see if they can do it. I would just have fun. That's my say to that. Let's see. Rada says that she's teaching a class today, but she's having rotator cuff surgery Tuesday for a full thickness tear in her dominant side arm. Lots of foot treatments post-surgery, face treatment, yep, hand treatments, but won't be able to get on the floor. I'm curious about what roller on the walls. Guys, after doing a rotator cuff surgery, I would be putting the roller up against my back and rolling up and down my back. I would also be doing things without the roller, and I would just be sitting in a chair and doing rib side bending. I would do things that move my ribs in every possible direction, anything that moves my head away from my shoulders so that I'm causing tension into the tissue that runs over my shoulders without moving my shoulder joint. And then when they start getting you moving after it's been in the sling, you'll just start to work your way back. Bonnie asks, I'd like recommendations for MELT moves post hip replacement surgery and what to avoid and for how long. Again, it's about the person. I would go to one of the hip series that we have on MELT on Demand. But the most important thing, post a hip replacement, you want to do foot treatments, calf work, upper body compression if they can get themselves to move against the roller, and then slowly working them toward back thigh and inner thigh. I usually start all of my people who have hip replacements right on their bed. I tell them to just pull the covers away and doing a little bit of back thigh shear, just even if they're just wobbling their leg or pinning and creating a subtle dragging. That's what I would be working on at the beginning. And then, over time, it's more upper back, getting them more inclined into rib length, upper back, glide, shear, and rinse, and then slowly work them back toward their hip. There's nothing really that you need to avoid in any of the MELT. Hip to heel, press, rotate, and cross, if you do it correctly, you can do that movement too because the joint range is minimal. Emma Grace, you're talking about a client who has degenerative disc disease, thoracic and lumbar spine. Any recommendations or contraindications? Upper back glide and shear is off limits. Yeah. You can't do, when you have degenerative disc disease, you're better off doing lengthening techniques, hand and foot treatments, skipping a lot of the compression. But I would also, some of that stuff I talked to you guys about before, getting rhomboids to activate, squeeze rhomboids, learn the difference between rhomboids and rear delts, then get into the rotator cuff. Do some neurostrength with people like this. Dawn, she's saying, have I ever seen any improvements with sleep apnea with sternal release and the neck turn, reach, and neck side bend? Yes, to some extent, but the face treatment is definitely something to do. And a lot of that also is like sternal decompress is big because it's a great one to pull hydration to the throat. There's so many other things to think about. Okay, finally, I have one left. Oh my gosh, Amy Brown, just checking in now. To have a good heart cry, and I'll watch the rest later. My response on the Facebook thread, she did prolotherapy, but it was before surgery. She did stem cells in her shoulder. She had a ridiculous record-setting harvest, but bled out horribly after it. And at that time, they would do no stem cells in the low back, but I can find out more. Yeah, I'm telling you, Amy, honestly, the prolotherapy for exactly the type of pain you're talking about, that's where I would start. I have seen miracles with that stuff along the spine. You get somebody to just put vitamin B all the way down your spine, and then the prolotherapy. It just induces that inflammation. You're going to be sore as hell the next day, but then the next day after that, you might actually start feeling changes. But the stem cell also for the spine is, the regenerative stuff is really going pretty far now. But PRP therapy might also be an option.
Wow, Sue. It's like 5 p.m. exactly. You got through everything. I'm so impressed.
I've literally been talking since 11 a.m. My voice is like, I need more water. I hope, what other things does prolotherapy go? Just look up prolotherapy. Just look it up. Yeah, just go to the internet and type in prolotherapy. It's just a sugar solution that they inject in you, and it creates local inflammation. It's amazing stuff, though. I think it actually has a lot of validity. Like I had one time where I told you guys I passed out in a hot tub, or I mean in a sauna after I came out of a sauna. I passed out, wrecked my knees, my head went back, and like for a few weeks I was like, these fingers on both sides are falling asleep every time I sleep. It's in my neck, right? So I melted, I tried to do it myself, and I was just like, I couldn't get out of it. So I had a chiropractic adjustment, and then I had prolotherapy, and it disappeared. And it has not come back, right? So sometimes those things are great alternatives to surgeries. You guys should be looking into stem cell research, prolotherapy, PRP therapy, some of the electromagnetic frequencies that they have. There's all sorts of incredible stuff out there. And I think technology will ultimately catch up with us a little bit to help us with our aging process. That's my hope. Anyway, exactly, Kathleen. Come on. All right, you guys can unmute yourselves. Carrie, is there anything else we want to tell them before we say goodbye?
I don't think so, unless you wanted to do some testimonials, Sue.
Oh yeah, if anybody wants to stay for a few minutes, stay on and we can do a couple of testimonials. And of course, sip water frequently, eat water-filled foods, and call somebody that you love and put some of your positive vibes out there. And get on Melt on Demand, for God's sake. God, get on Melt on Demand. Do it.
Yeah, I think Sonia, she called herself out. I think Sonia.
I'm doing it.